much. As we continue to highlight Mental Health Awareness Month, we're taking time to address how law enforcement officers' mental health can be impacted by their jobs. 23 ABC's Brianna Willis joins us now live in studio with more on this. Brianna.
Mark, from protecting others to protecting themselves, law enforcement personnel put their lives on the line every day, but this can also take a toll on their mental health. That's why the Kern County Sheriff's Office was able to receive funding to support more officer wellness and mental health resources. Oftentimes, law enforcement cannot know for sure what they are going to encounter when they arrive on a scene.
Mental health is really important because if you think about the kind of things that a deputy sees on a daily basis, you're not seeing, normal things on the job.
Lori Meza with the Kern County Sheriff's Office says deputies sometimes have to deal with losing each other.
When we had an incident where, a deputy was killed in the line of duty, people tell you, well, that's expected, isn't that something that you sign up for? And yes, the answer to that is yes. However, it is still a coworker that I lost.
KCSO also works with Kern Behavioral Health and Recovery Services for crisis intervention, which works with deputies to establish techniques for high-risk situations.
Before we arrive on scene is, some mindfulness, try to be in the present moment. Some deep breathing. Of course, when you arrive on scene and it's a crisis, you automatically are elevated and you have adrenaline rushing, and you have to be able to make decisions in split seconds.
Law enforcement's mental health can also be affected after they are off duty.
Deputies do deal with PTSD, dealing with a lot of these traumatizing instances and situations. And this obviously affects a lot of our deputies in terms of even after the job, once they've retired, you do see a higher rate of suicide in first responders, specifically law enforcement first responders.
According to the FBI, law enforcement suicide data collection based on data from only 22 agencies, 32 people in law enforcement died by suicide in 2022 in the United States, and 9 attempted suicide. Ramirez adding it's important to take time to let out what you might have encountered.
We come back and we debrief. We don't hold it in, we consult, and you have to get it out or it's going to stay with you and it's going to have a ripple effect that might lead in a negative way and kind of hinder your life if you aren't able to take care of yourself.
KCSO has received added funds to help address mental health concerns among its staff, courtesy of the California Board of State and Community Corrections.
Implementing this, we can now start to implement mental health awareness into the academy. And so that way we don't have to wait until an incident occurs to offer peer support to a deputy.
Meza adding this is important because it protects everyone.
A healthier deputy is a better deputy.
That grant funding is $501,000, and KCSO will continue to be able to use it through December 2025. They will also provide reports as to what mental health resources they are using with the funds. In studio, Brianna Willis, 23 ABC News, connecting you.